Welcome to Healthcare Futurist. In this episode, which is actually a continuation of the episode which we did on remote patient monitoring, we will discuss the step-by-step guide on how to implement a RPM or a remote patient monitoring using wearable devices. Step 1 is to identify a need and then form your team. Whenever we are implementing a new technology or a new initiative, we have to be clear about why we are doing it. What is the need for doing it? The need could be for a hospital. There is an increasing number of patients who are getting readmitted after a surgery, like cardiac surgery. Many patients are getting readmitted because of issues, or patients discharged from the hospital after a critical illness. The readmission rates are significantly increased, which means that these patients needs to be monitored in their home so that early deterioration can be recognized and a proactive approach can be made. So this is one need in which a remote patient monitoring is indicated. The second is if a hospital has got a large number of patients with chronic illness like COPD, patients with cardiac failure, patients with diabetes mellitus which is poorly controlled, or patients whose hypertension needs to be controlled who have multiple comorbidities or other illnesses. So you have a large number of patients who needs to be continuously monitored at home. If a hospital is affiliated with care homes or aged care homes where people who are sick who needs to be taken care of, then that is a need. Third need is if the hospital institution is looking to expand its revenue stream. Once you have identified the need, along with the need, one has to engage the key stakeholders, which includes the physicians, the nurses, and the non-clinical staff or the administrators, the organization leaders, to form a dedicated RPM implementation team. It has to start from above. The organization leaders should get convinced regarding the need for a remote patient monitoring initiative for patients who are outside the hospital setting. Then we have to identify the physicians and the non-clinical staff who are going to implement it. The second goal is to define the success criteria for your RPM program based on your identified need, focusing on health outcomes, patient experience, financial reimbursement, and provider satisfaction. So these are probably the 4 areas in which one has to monitor the outcome of the initiative. The third is whether to buy the RPM devices or lease them. There are 2 things that needs to be considered. When you are leasing a device, naturally the bulk of the monetary advantage or the profit goes to the company who is leasing that, where the hospital will get only a very small percentage of the financial incentive. Whereas when you buy a device, which actually is much cheaper and cost effective in the long run. But the other disadvantage is the technology is evolving very fast, and every year new wearable devices are coming to the market. So when the hospital makes an upfront purchase and the technology advances, that becomes counterproductive. So both these should be considered before deciding on whether to lease or to buy RPM devices. The fourth and the most crucial step is to identify and recruit eligible patients. Who are the patients who are eligible or who might benefit from an RPM? You have to identify patients who are critically ill, who are discharged from the hospital, like patients after cardiac surgery, critical illness, who needs continuous monitoring. These are the group of patients who will benefit the maximum. Second is the patients who have chronic illness with multiple comorbidities in setups where they are not continuously monitored. This is the group of patients who will benefit from this. And third, one has to consider what is the reimbursement options for these monitoring, because these are expensive. When the patients are monitored 24/7 on a day-to-day basis, this becomes quite expensive, and whether they are eligible for reimbursement. Step number 5 is to train patients and clinicians. One has to develop training materials to educate patients on, because this is used at their home, how to use the device, what are the expectations, and what are the actions to be done based on the readings. Comprehensive training has to be given to the clinicians as well as the technicians on the utilization, program implementation, and patient management. Step number 6 is come to the actual delivery of the RPM and how to engage the patients. One has to launch the RPM program, and there has to be a monitoring system or a command center in the hospital. Developing a command center in the hospital where the data can be monitored continuously, and the people who are privileged to monitor that immediate escalation matrix continuously engage with the patient troubleshoot technical issues, provide ongoing support, and take proactive steps when there is something abnormal in the RPM. Step number 7 is monitor and analyze patient data. That is what I discussed. Data will be generated when large number of patients are monitored from different locations. If you're planning to implement an RPM, the first step should be to develop a command center or a centralized monitoring center in the hospital with adequate staff who can monitor the data 24/7, and then systems should be in place on what should be done when there is an abnormality, how to identify the patterns, trends, and actionable insights so that patient care and interventions can be effectively implemented. Step number 8 is to optimize program and patient outcomes. Once you analyze this data and based on the feedback, the program should be redefined and refined so that the patient engagement should be improved, strategies for that should be implemented so that the health outcomes are optimized. Number 9 is ensure that there is a compliance and reimbursement. One is to whether all the statutory compliance are met, and second is whether adequate things which are essential for reimbursement, insurance reimbursement, are met so that the financial burden of the patient becomes less. Last, step number 10, implement it on a smaller scale initially, set everything in place, evaluate the outcome, have definite key performance indicators for this. Once this is done, conduct regular program evaluations, assess the effectiveness, identify areas where improvement is required, then go for an expansion plan. Suddenly jumping into a huge RPM monitoring system definitely can backfire. And once you have done that, explore opportunities to scale the RPM program and gradually integrate additional technologies for enhanced patient care. For example, sleep evaluation, fall prevention strategies. So many new technologies are coming, or new wearables or peripherals are coming, which can be incorporated into the remote monitoring system. So again, I reiterate, the first step is to identify and establish the team along with the command center in the hospital. Implementing these 10 steps will help healthcare providers successfully establish and manage a remote monitoring program using wearable devices, facilitating improved patient outcomes and optimized healthcare delivery. Thank you. Please share your comments, your feedback, and your thoughts about this program. See you next time at another episode of Healthcare Futurist.